These legs belong to Julie Janney, and she has had enough of the varicose veins. Is that correct, Dr. David
Yes.
M. Duffy? That's what we should call those?
No, call those spider veins or
Spider
reticular veins.
And she's decided they need to go away. That's why we're at your office. You're famous for this non-invasive, non-surgical treatment of veins. Let us show you how this works on hands. Earlier this morning, we took a look at the procedure. We saw a very veiny hand. You inject, what is that?
This is sclera. Sclera is an approved substance to treat the veins. It dries them out. Now, when you do the hands, it is not FDA approved because they haven't studied it, but it's legal to use as long as you tell the patient.
All right, but on legs, it's okay. Take a look at this. This is one of his other patients. You see the before and after. The results are dramatic.
They are dramatic in some and they don't work in others. It's like everything else. The person who does best doesn't have a lot of veins. They're all in the same size range and they haven't been treated 100 times. There are all sorts of little problems, but no major ones with this, provided you know what you're doing.
All right, let us show you Julie's leg before. Now, this was 6 months ago, Julie.
Right, 6 months ago, because since I was quite young, I had these tiny spider veins all on my legs. So I worked so hard, I thought, I want to be able to wear, I want to be able to show my legs.
I get that.
So I was referred to Dr. Duffy by my dermatologist, and I came 6 months ago, and he did an amazing job.
And let us show you the procedure while you explain what you did with her legs, similar to what you do the hands.
Well,
Here, take a look at this.
Basically, you simply inject them, and then afterwards you use compression hosiery. The very small veins, it may not be as important, but it does seem in some patients at least to really enhance the procedure. Then you usually see them several times, maybe 3 for the smaller veins. Oddly enough, as the veins get bigger, it takes fewer treatments, but you do need more compression.
All right, follow up. She's going to need to do?
Well, lots of walking, no high-impact aerobics, maybe for a week. She'll wear the hosiery overnight for at least 2 nights.
Now, this is what you're talking about, compression hosiery?
Yes. This compression hosiery is called graduated. It squeezes more at the ankles where the pressure is higher and pushes the blood back toward the heart. What it really does is it mashes those sides of the veins together, the walls of the veins together, so it makes this work better.
Interesting. All right, let us give you information. Again, we're at the offices of Dr. David M. Duffy, board-certified dermatologist, and we're talking about new year, new you, so maybe you can do something about your veins.